Good morning. I'm here today to talk to you guys about Governor Brian Kemp and his handling of the coronavirus pandemic in the state of Georgia. Brian Kemp has consistently failed the state of Georgia in his efforts to prevent the spread of the coronavirus. Recently, on July 15th, he issued an executive order banning local government leaders from mandating public safety measures, such as requiring people to wear masks. And on July 16th, he sued the city of Atlanta simply for requiring people to wear masks while out in public. These types of decisions are ignorant and made without the consultation of top medical experts. I find it simply ridiculous that Governor Kemp continually ignores the advice from top medical experts, such as the CDC, who are based in Atlanta, Georgia. They're literally in his own backyard, and he still ignores their advice all the time. There are people's lives at stake here. For example, the Atlanta Journal-Constitution reported that Ron Hill, my high school football coach, a U.S. veteran, beloved member of the Mount Vernon School and local Sandy Springs community, died of COVID-19 on April 14, 2020. This was a great man, father figure to many. As I said, one of my favorite football coach, loved by the school. It was a heartbreaking loss for the entire school community. And it was really sad, and preventable is the most frustrating part. He also had 7 children of his own, 16 grandchildren, and again, relationships with countless students, parents, faculty. It hurt the community and, more importantly, hurt his own family. And sadly, he also had to die alone. Since he was infected with coronavirus, the hospital would not let his daughters near him. They had to say goodbye through a glass window as he laid sedated. His oldest daughter is quoted saying that he didn't even know they were there as he passed. This kind of death is extremely preventable with simple policies that could be enacted. In a CDC study reported July 17th, 2020, they reported that in a local Missouri hair salon, 139 clients were exposed to 2 symptomatic hairstylists who had confirmed cases of COVID-19. However, both stylists and the clients wore face masks, and there were no symptomatic secondary cases reported. And among 67 clients tested for COVID-19, all came back negative. The CDC believes that the adherence to the community and company's face covering policy was the likely cause of mitigating any spread of COVID-19. That means that in a face-to-face, long-term interaction, over 10 minutes, exposed to someone who is infected with COVID-19, all 139 people tested negative or showed no symptoms of coronavirus. As we all know, getting a haircut, you're face-to-face talking to a hairstylist the whole time, something that everybody would assume would spread coronavirus. That's why hair salons and places like that were shut down. But the simple act of wearing a mask stopped evidently all spread of the virus. Similarly, the Journal of the American Medical Association did a study in late March of 2020 in the largest healthcare system in Massachusetts. Before masks were required, new infections among healthcare workers with direct or indirect patient contact were increasing exponentially from 0 to 21%, or about 1% a day. However, after the universal masking policy was put into place, that rate was decreasing by about 0.5% a day. That means just less and less doctors who were directly exposed to patients with COVID-19 or indirectly were no longer testing positive. And that was without requiring patients to wear masks. So imagine what would have happened if patients and doctors were both wearing a mask while interacting with each other. If Governor Kemp does not care about the people he represents as governor, he should at least care about his own health and safety. In an article from the LA Times in late June, Karen Kaplan summarized a report from the CDC on the effect age has on COVID-19. The CDC is quoted as saying age is an independent risk factor for severe illness. In other words, as someone gets older, someone ages, their risk for a severe reaction to COVID-19 increases exponentially. Governor Kemp is 56 years old. He is very much at risk for a severe complication if he is infected with COVID-19. My parents are at risk, my grandparents are at risk, all of our families are at risk, including his own. He needs to do something more to prevent the spread of coronavirus. It is frustrating to watch him consistently ignore the advice, as I said, of high-level medical experts, especially when it's something as simple as putting a piece of cloth over your mouth while walking around in public. Public safety requirements are nothing new, especially during a crisis, but we experience them every single day. We wear a seatbelt when we're out on the road to prevent ourselves and to keep ourselves safe, to prevent us from flying out of a car window. We stop at red lights and stop signs to protect other drivers so we don't cause an accident. We don't drive under the influence so that we are not putting other people's lives at risk who are out on the road. It should be a simple common courtesy to just wear a mask during a pandemic. Unfortunately, for some people, it isn't. And that is why we need Governor Kemp to step up with regulation. It's an easy solution to a serious problem, a preventable problem, and we need his help. This continued ignorant behavior from the governor is putting his own life and, more importantly, the lives of every single resident of Georgia at risk. Governor Kemp needs to revoke his executive order banning the requirement to wear a mask and drop his lawsuit against the city of Atlanta immediately. If not for the sake of those he's meant to protect, he's sworn to protect, then at least for his own safety. Thanks. And I'm opening up to questions.
I did not hear about him suing the city of Atlanta for having a mask mandate. That's crazy.
Yeah, it was, like I said, the day after he basically issued an executive order saying you guys can't do any of this, and then a day later, the mayor of Atlanta went against him, and he started a lawsuit. It was weird.
It's so odd that he's like so against having people be required to wear a mask in public.
Yeah, especially because 4 days ago we had 5,000 new cases, or almost 5,000 new cases in one day. So it was, and 4,000 the day after. So
yeah, that's crazy.
Yeah.
Sorry, I was muted. People can still choose to like wear a mask if they want to, right?
Yeah, absolutely. But
okay,
a lot of people, especially in Georgia, are very much like, this is an infringement on my rights or whatever, so they won't, or it's just uncomfortable, so they're not wearing one.
Yeah, I mean, you mentioned people being like predisposed to the virus, and my mom actually has type 1 diabetes, so she's also more predisposed to it. So that's definitely something that I don't think people realize, and they can be like selfish about it. Like, that's why I try to be careful, like, because with my family, they're predisposed. Even though people might not think, oh, like I won't have symptoms, like I'll be fine. I think people need to put more consideration into others as well.
Yeah, I agree.
But, yeah. I heard that they're starting to test like the coronavirus vaccine though on humans, and I was just wondering, like, would you consider getting the vaccine? And like, do you still think people should be required to wear a mask, like even if they have a vaccine?
Personally, I think once the vaccine is out, I mean, there's the issue of, if people don't want to take the vaccine, but that could be another kind of government public safety measure. I think that's a little bit more extreme than asking people to put a piece of cloth over their face. But I think once the vaccine is out and it's pretty widespread, I think the risk goes down. So, but since we don't have a vaccine yet, I think it's kind of a buffer before the vaccine comes out, I guess. Because it doesn't have to be anything permanent. It's just like wear a mask outside for 2 months. And, there's a report from the CDC that if we did that, we should be kind of in the clear anyways.
Right. Yeah, I had a,
so do you, oh, sorry, go ahead.
No, you're good. I just was going to say, like my topic has to do with Corona and everything. And I found a graph from the South Carolina Department of Health and Environmental Control. And it's like, if everybody wore a mask, it said like universal mask, like the number of cases just like immediately decreases. And like, I guess some people just don't understand how easily a mask can help like stop the spread, which is so annoying.
Yeah.
Yeah.
Yeah, I think education is probably another important part of it.
Sorry.
No, go ahead. Sorry.
I keep like talking and then it lags and then someone else. Do you think that your governor would be like more open to requiring a vaccination, or do you think that he would also be like super opposed to that too?
If he won't require us to wear a mask, I'm pretty sure he's not gonna require a vaccination. He's he's a hard right leaning, very much like, it's against our constitutional rights or whatever. So he carried a shotgun in his campaign videos. I'd be shocked if he required us to do any kind of vaccine or anything like that. How do you guys feel your states have handled the coronavirus, I guess, in comparison to how Georgia's doing?
Yeah, like I said, being in Florida, they handled it very poorly. We we opened up restaurants and like bars and everything after a while. I think we opened it way too early because then we had to shut down bars again, and like alcohol sales at restaurants have been limited because we're trying to get people to stop going out, but it's a mess here.
Yeah.
So
Yeah, I think Florida's the new
I'm
#1, right?
yeah, it's
sorry.
it's been interesting. We have like a ridiculous amount of new cases every day. And I thought I had corona the past week because I was sick for like a week and a half and had to go get tested twice,
Jeez,
but it was negative. So
that's good.
Yeah, I was gonna say, I'm from Maryland, and I actually think that we handled it pretty well because we pretty much shut down everything. Like we had a stay-at-home order a lot before like South Carolina did or anything. And when I came back in May just to visit, come back to my apartment, it was just kind of shocking to see everyone not wearing masks or like social distancing because Maryland was so strict about it. So it almost felt like two different worlds.
Yeah.
And we kind of now it's hard to see like South Carolina. If they would have taken it more serious in the beginning, then it would have been better for us to come back. But I guess we'll have to see how that pans out because I know that we are going back for in-person instruction, but at least they have like the mask rule there.
Yeah. I think all of my classes are online now except for golf. So
I only have one class that's on campus, and the rest of mine are online.
I think we're about done, but thank you guys.